Breast cancer is the commonest cancer amongst women, and it is very treatable. So you palpate it firmly, the 4 quadrants. You palpate the inner firmly, and you palpate the down part firmly. After doing that, you palpate the center too. Hi, I am Dr. Bells. I'm 29 years old and I've had 3 breast surgeries. I discovered the first one when I was 13. I was taking my bath and I noticed something abnormal on my right breast. It was just like a seed. So I checked the left one if it was there too, and it wasn't there. But I just neglected it because it wasn't painful and I felt it was going to go on its own. So I didn't bring it to anybody's attention until 2 years later when I was 15. It was still there. I told my mom and she took me to the hospital where a doctor saw me, asked me questions and examined me. Then he sent me for some tests, after which he booked me for a surgery. He reassured me that there was nothing to worry about, that it was a day's procedure and I'll be able to go home on the same day. So on the day of the surgery, I wasn't scared because they said I was going to be awake all through the surgery. It was short, lasted I think about 30 minutes. They gave me medications and I went home. The second time I discovered the breast lump was when I was in, I think, my second year in the university. That one was on my left breast. Since I already had done it before, it just felt like it's same old. So I told my mom, we went to see a doctor and he booked us for surgery after doing the necessary examinations and tests. And I went back home after the surgery. In 48 hours, I was back to myself. I discovered the third one when I was in, I think, my 4th year in the university, and it was discovered on my right breast again. I just kept wondering what was going on and why it just kept happening over and over again. And as usual, we went to the hospital, they did what they had to do, went in for surgery, and I came out and I recovered fully. So one thing that I noticed that they did after every surgery was to take the lump to the lab for testing to check if it was malignant or not. Because if it was malignant, of course, it will have a different treatment option. And when it came back, all of them, they came back to be fibroadenoma, which is a non-malignant breast tumor. So while I was in med school, they taught us about breast tumors, the benign and the malignant ones, risk factors, and I kept wondering why mine was reoccurring. And I realized that I had one risk factor, which was early menstruation. I started seeing my period when I was 9 years old. So I just felt that this was the predisposing factor, because I asked my mom if any family member had ever had breast cancer or breast lump, and our response was always no. So aside early menstruation and a family history, I also found that other things could predispose one to having breast cancer or breast lump, and that included intake of alcohol, smoking, the use of hormonal therapy for whatever reason. And that also kind of spurred me into making that healthy decision of eating healthy and exercising. So I don't take alcohol at all. I don't smoke. I don't use any hormonal therapy for whatsoever reason. I exercise 3 to 5 times, actually 3 to 6 times every week. And I cut off fizzy drinks about 4 years ago, in 2016. I also cut off pasta for over 2 years. I tried to reduce the intake of highly processed food and food that has a lot of preservatives. And so far so good. My life has really been very blissful and I haven't come down with any breast lump since the 3rd incident. I discovered the breast lump by a random check, and now as a professional I realized that there are even better ways that you can go about it, and it's called a self breast examination. You can do it while standing or while lying down. So while standing, you look at the mirror, you put your hands behind your head, and you look at both breasts and you compare them. What are we looking out for? So you're checking if they are the same size, the same shape. Normally, one breast is bigger than the other, but it's not so significant. So if you realize that one is significantly bigger than the other, then it calls for concern. Then you also look out for discoloration. If some parts are darker than the other parts, you're checking if there's any redness. You're checking if some parts are also lighter than the other parts. Then you're also checking for dimpling. Now, I know some people may see that as a beauty mark, but it calls for concern as it may be a sign of a malignancy. We're also checking if the skin around your breasts looks like an orange peel. We call it peel d'orange. You're also checking if your nipples are inverted. Now, normally some people have inverted nipples, but if you always realize that your nipples have always been inverted and suddenly it is now inverted, then it calls for concern. You lift your hands upwards, you compare both breasts, and you also take your hands downwards. Now, when examining it, you use the pulp of your fingers to palpate it and check for the presence of lumps. You divide the breast into 4 quadrants. So you have the upper inner, you have the lower inner, you have the lower outer, and you have the upper outer. What you do is that you put the hand of the breast you're going to be examining, you put it at the back of your head, and you use the pulp of your hand and you start palpating. So you're palpating it. It's your breast, don't be afraid to touch it. So you palpate it firmly. You palpate it firmly. The 4 quadrants. You palpate the inner firmly and you palpate the down part firmly. After doing that, you palpate the center too, because you may have any lump lurking around there. Now, when you've done that, while palpating, there's this part of the breast that is called the axillary tail. It's like an extension of the breast. So you also palpate that part and you're checking if there is any lump there. Afterwards, you check for lymph node enlargement, and that is usually done in the armpits, because if there's a malignancy, the first spread is at the axillary region, which is your armpits. You palpate that way. So you call it part posterior, you call it part anterior. You palpate the inside apex, and you also palpate this upper part. So you're checking if there is any enlargement, any lump. After doing that, we try to express the nipples to make sure that there's no form of discharge, especially if it's a bloody discharge. Now, if you're not breastfeeding and you're also discharging milk, it calls for concern. You should try and see a doctor to make sure that it is not an hormonal imbalance or something else. So you express it in 2 planes like this. Express it vertically, and you express it horizontally, checking if you see any form of discharge. So you do the same for the right breast using the left hand and following every procedure that was described. So if you feel that this is too much, you can always go to the hospital and get a clinical breast examination done, because it is recommended for every woman once she hits puberty to do this at least once a year. Breast cancer is the commonest cancer amongst women, and it is very treatable, but early detection is key. It's been 8 years since I had the last surgery, and I've been doing my best to live a healthy lifestyle. I've been eating right, I've been exercising, and I encourage every woman to do the same. So take charge of your health, because it's in your hands.